Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A nurse reviews a client's ECG rhythm strip. The rhythm is regular, the heart rate is 78 beats/min, each P wave is followed by a QRS complex, and the PR interval is 0.16 seconds. Which rhythm should the nurse identify? A. Sinus Bradycardia. B. Normal sinus rhythm. C. Atrial fibrillation. D. Ventricular tachycardia. Correct answer, B. Normal sinus rhythm. Rationale. Normal sinus rhythm has heart rate, 60 to 100 beats/min, regular rhythm, 1 P wave before every QRS complex, PR interval 0.12 to 0.20 seconds, QRS duration, less than 0.12 seconds. The client's ECG meets all of these criteria. Question 2. Which assessment finding is expected in a client with sinus bradycardia? A. Heart rate of 52 beats/min. B. Heart rate of 118 beats/min. C. Irregular rhythm. D. Absent P waves. Correct answer, A. Heart rate of 52 beats/min. Rationale. Sinus bradycardia may be normal in athletes but can also occur with certain medications or increased vagal tone. Question 3. A client has a heart rate of 148 beats/min with irregular rhythm and normal P waves preceding each QRS complex. Which dysrhythmia should the nurse identify? A. Sinus tachycardia. B. Ventricular fibrillation. C. Atrial flutter. D. Third-degree heart block. Correct answer, A. Sinus tachycardia. Rationale. Sinus tachycardia common causes include pain, fever, anxiety, dehydration, hypovolemia, and exercise. Question 4. Which client is most likely to develop atrial fibrillation? A. A client with long-standing hypertension. B. A healthy teenager. C. A client with appendicitis. D. A client with a fractured wrist. Correct answer, A. A client with long-standing hypertension. Rationale. Atrial fibrillation increases the risk of stroke because blood can pool in the atria and form clots. Question 5, SATA. A nurse is assessing a client with atrial fibrillation. Which findings should the nurse expect? Select all that apply. A. Irregular rhythm. B. Absence of distinct P waves. C. Increased risk of stroke. D. Regular ventricular rhythm. E. Palpitations. Correct answers, A, B, C, E. Rationale. Atrial fibrillation is characterized by irregular rhythm. No identifiable P waves. Increased risk for thromboembolism and stroke. Palpitations, fatigue, dizziness, or shortness of breath. The ventricular rhythm is not regular. Question 6. Which dysrhythmia is considered immediately life-threatening and requires immediate defibrillation? A. Ventricular fibrillation. B. Sinus bradycardia. C. First-degree AV block. D. Sinus arrhythmia. Correct answer, A. Ventricular fibrillation. Rationale. Ventricular fibrillation is a chaotic rhythm with no effective cardiac output. Immediate CPR and defibrillation are required to improve survival. Question 7. A nurse identifies ventricular tachycardia on the cardiac monitor. The client is unconscious and has no pulse. What is the nurse's priority action? A. Begin CPR and prepare for defibrillation. B. Administer oral metoprolol. C. Obtain a 12-lead ECG. D. Reassess the client in 15 minutes. Correct answer, A. Begin CPR and prepare for defibrillation. Rationale. Pulseless ventricular tachycardia is treated the same as ventricular fibrillation. Question 8. A client suddenly develops frequent premature ventricular contractions, PVCs. What should the nurse assess first? A. The client's blood pressure and symptoms. B. The client's meal preference. C. The client's skin color only. D. The client's height. Correct answer, A. The client's blood pressure and symptoms. Rationale. PVCs may decrease cardiac output. The nurse should first assess the client's hemodynamic status, including blood pressure, level of consciousness, chest pain, shortness of breath and dizziness. Question 9. Which electrolyte imbalance commonly increases the risk of ventricular dysrhythmias? A. Hypokalemia. B. Hypercalcemia. C. Hypernatremia. D. Hyperchloremia. Correct answer, A. Hypokalemia. Rationale. Low potassium levels increase myocardial irritability and can lead to premature ventricular contractions. Potassium levels should be monitored closely in clients taking diuretics. Question 10, SATA. A nurse is teaching a client with a history of dysrhythmias. Which instructions should the nurse include? Select all that apply. A. Take medications exactly as prescribed. B. Report chest pain or fainting immediately. C. Keep follow-up appointments. D. Stop taking antiarrhythmic medications once you feel better. E. Limit caffeine intake if advised by your healthcare provider. Correct answers: A, B, C, E. Rationale. Clients with dysrhythmias should take medications consistently. Report symptoms such as chest pain, syncope, palpitations, or shortness of breath promptly. Attend regular follow-up appointments. Limit stimulants such as caffeine if recommended. Antiarrhythmic medications should never be stopped without consulting the healthcare provider. Question 11. A client has a heart rate of 42 beats/min and reports dizziness and fatigue. Which action should the nurse anticipate? A. Encourage the client to ambulate. B. Prepare to administer atropine. C. Administer epinephrine immediately. D. Encourage the client to drink coffee. Correct answer: B. Prepare to administer atropine. Rationale. Symptomatic sinus bradycardia, heart rate less than 60 beats/min with symptoms such as dizziness, hypotension, or syncope, may require atropine to increase the heart rate. If atropine is ineffective, transcutaneous pacing may be necessary. Question 12. The nurse identifies a prolonged PR interval greater than 0.20 seconds on an ECG. Which dysrhythmia should the nurse suspect? A. First-degree AV block. B. Atrial fibrillation. C. Ventricular tachycardia. D. Sinus tachycardia. Correct answer: A. First-degree AV block. Rationale. A first-degree AV block is characterized by PR interval greater than 0.20 seconds. Every P wave is followed by a QRS complex. Usually asymptomatic. Often requires monitoring rather than immediate treatment. Question 13. A client suddenly develops ventricular tachycardia and has a palpable pulse. What is the nurse's priority action? A. Assess the client's blood pressure and level of consciousness. B. Begin CPR immediately. C. Prepare for defibrillation without assessing the client. D. Leave the client and notify the provider. Correct answer: A. Assess the client's blood pressure and level of consciousness. Rationale. Pulseless ventricular tachycardia requires CPR and defibrillation. However, if the client has a pulse, the nurse should first assess whether the client is stable or unstable to determine the appropriate intervention. Question 14. Which ECG finding is characteristic of atrial flutter? A. Sawtooth flutter waves. B. Absent QRS complexes. C. Wide PR intervals only. D. Flat T waves. Correct answer: A. Sawtooth flutter waves. Rationale. Atrial flutter is characterized by sawtooth flutter, F. Waves, atrial rate of 250 to 350 beats/min, regular atrial rhythm, increased risk of thromboembolism. Question 15, SATA. A nurse is assessing a client with symptomatic bradycardia. Which findings should the nurse expect? Select all that apply. A. Dizziness. B. Hypotension. C. Syncope. D. Fatigue. E. Hypertension. Correct answers, A, B, C, D. Rationale. Symptomatic bradycardia decreases cardiac output and may cause dizziness, hypotension, syncope, fatigue and weakness. Hypertension is not typically associated with symptomatic bradycardia. Question 16. Which electrolyte imbalance is most likely to cause cardiac dysrhythmias? A. Hypokalemia. B. Hyperalbuminemia. C. Hyperproteinemia. D. Hypoglycemia. Correct answer, A. Hypokalemia. Rationale. Potassium is essential for normal cardiac conduction. Low potassium levels increase myocardial irritability and may lead to premature ventricular contractions, PVCs. Question 17. A client has atrial fibrillation. Which complication is the nurse's greatest concern? A. Stroke. B. Pneumonia. C. Appendicitis. D. Osteoporosis. Correct answer, A. Stroke. Rationale. In atrial fibrillation, blood may pool in the atria, increasing the risk of clot formation. If a clot travels to the brain, it can cause an ischemic stroke. Many clients require anticoagulation therapy to reduce this risk. Question 18. A client with ventricular fibrillation suddenly becomes unresponsive. What is the nurse's first action? A. Begin high-quality CPR. B. Administer oral medications. C. Obtain a blood glucose level. D. Check the client's temperature. Correct answer, A. Begin high-quality CPR. Rationale. Ventricular fibrillation is a pulseless, life-threatening rhythm. Immediate CPR should begin while a defibrillator is obtained. Early defibrillation significantly improves survival. Question 19. A client with a permanent pacemaker asks why it was inserted. What is the nurse's best response? A. It helps maintain an adequate heart rate when your heart beats too slowly. B. It permanently cures heart disease. C. It lowers your blood pressure. D. It prevents heart attacks. Correct answer, A. It helps maintain an adequate heart rate when your heart beats too slowly. Rationale. A pacemaker is used to treat certain bradyarrhythmias by delivering electrical impulses when the heart rate becomes too slow. It does not cure heart disease or prevent myocardial infarction. Question 20, SATA. A nurse is teaching a client with a newly implanted permanent pacemaker. Which instructions should the nurse include? Select all that apply. A. Carry your pacemaker identification card at all times. B. Report dizziness or fainting immediately. C. Keep follow-up appointments to have the pacemaker checked. D. Avoid placing strong magnets directly over the pacemaker. E. Stop all physical activity permanently. Correct answers, A, B, C, D. Rationale. Clients with pacemakers should carry identification indicating they have a pacemaker. Report symptoms such as dizziness, syncope, or palpitations. Attend routine follow-up visits to evaluate pacemaker function. Avoid prolonged exposure to strong magnetic fields that may interfere with device function. Clients can usually return to normal activities after recovery, following their healthcare provider's recommendations. Permanent avoidance of all physical activity is unnecessary. Questions 21. A nurse reviews an ECG strip showing a chaotic rhythm with no identifiable P waves, QRS complexes, or T waves. Which rhythm should the nurse identify? A. Ventricular fibrillation. B. Atrial flutter. C. Sinus bradycardia. D. First-degree AV block. Correct answer, A. Ventricular fibrillation. Rationale. Ventricular fibrillation, VF, is characterized by a medical emergency requiring immediate CPR and defibrillation. Without prompt treatment, VF is fatal. Question 22. A client suddenly becomes unresponsive. The monitor shows ventricular fibrillation. What is the nurse's priority action? A. Begin CPR and call for the defibrillator. B. Obtain a 12-lead ECG. C. Administer oral amiodarone. D. Assess bowel sounds. Correct answer, A. Begin CPR and call for the defibrillator. Rationale. The priority treatment for ventricular fibrillation is immediate high-quality CPR rapid defibrillation, activation of the emergency response team, following ACLS guidelines. Time to defibrillation is one of the strongest predictors of survival. Question 23. A nurse is caring for a client with atrial fibrillation receiving warfarin. Which laboratory value is most important to monitor? A. INR. B. Hemoglobin A1C. C. Serum sodium. D. Calcium level. Correct answer, A. INR. Rationale. Warfarin therapy requires regular monitoring of the International Normalized Ratio, INR, to ensure effective anticoagulation while minimizing bleeding risk. The typical therapeutic INR for atrial fibrillation is 2.0 to 3.0. Question 24. The nurse identifies frequent premature ventricular contractions, PVCs, on the cardiac monitor. What is the priority nursing intervention? A. Assess the client's oxygenation and electrolyte levels. B. Remove the cardiac monitor. C. Encourage vigorous exercise. D. Offer a high-sodium snack. Correct answer, A. Assess the client's oxygenation and electrolyte levels. Rationale. PVCs may be caused by hypoxia, hypokalemia, hypomagnesemia, myocardial ischemia, stimulants. The nurse should identify and correct the underlying cause before the rhythm progresses to more serious ventricular dysrhythmias. Question 25, SATA. A nurse is assessing a client with ventricular tachycardia who still has a pulse. Which findings indicate the client is unstable? Select all that apply. A. Hypotension. B. Altered level of consciousness. C. Chest pain. D. Signs of shock. E. Heart rate of 88 beats/min with no symptoms. Correct answers, A, B, C, D. Rationale. Unstable ventricular tachycardia may present with hypotension, chest pain, altered mental status, poor perfusion, signs of shock. These findings require immediate intervention, often synchronized cardioversion. Question 26. A client develops complete, third-degree, heart block. Which intervention should the nurse anticipate? A. Preparation for pacemaker insertion. B. Administration of oral antibiotics. C. Restrict fluid intake. D. Encourage ambulation. Correct answer, A. Preparation for pacemaker insertion. Rationale. Third-degree AV block is characterized by complete electrical dissociation between the atria and ventricles. Many clients require temporary or permanent pacemaker placement to maintain an adequate heart rate and cardiac output. Question 27. Which medication should the nurse anticipate administering to a stable client with symptomatic atrial fibrillation to help control the ventricular rate? A. Diltiazem. B. Acetaminophen. C. Insulin. D. Calcium gluconate. Correct answer, A. Diltiazem. Rationale. Calcium channel blockers such as diltiazem are commonly used to slow ventricular rate in atrial fibrillation. Other medications include beta blockers and digoxin, depending on the client's condition. Question 28. A client with a permanent pacemaker reports dizziness and fatigue. What is the nurse's priority action? A. Assess the client's pulse and obtain an ECG. B. Remove the pacemaker dressing. C. Encourage bed rest without assessment. D. Tell the client the symptoms are expected. Correct answer, A. Assess the client's pulse and obtain an ECG. Rationale. Dizziness and fatigue may indicate pacemaker malfunction or failure to capture. The nurse should assess the client's cardiac rhythm and notify the healthcare provider promptly if abnormalities are detected. Question 29. Which finding indicates successful defibrillation after ventricular fibrillation? A. Return of an organized rhythm with a palpable pulse. B. Continued chaotic electrical activity. C. Absence of electrical activity. D. Persistent ventricular fibrillation. Correct answer, A. Return of an organized rhythm with a palpable pulse. Rationale. Successful defibrillation restores organized electrical activity and effective cardiac output. After defibrillation, the nurse should immediately assess for a pulse and evaluate the client's hemodynamic status. Question 30, SATA. A nurse is teaching a client with recurrent dysrhythmias how to reduce the risk of future episodes. Which instructions should the nurse include? Select all that apply. A. Take antiarrhythmic medications exactly as prescribed. B. Keep all follow-up appointments with your healthcare provider. C. Report chest pain, palpitations, dizziness, or fainting immediately. D. Limit caffeine and other stimulants if recommended by your healthcare provider. E. Stop taking medications once your heart rhythm returns to normal. Correct answers, A, B, C, D. Rationale. Clients with dysrhythmias should take medications consistently as prescribed. Attend regular follow-up appointments. Report symptoms such as chest pain, palpitations, dizziness, syncope, or shortness of breath promptly. Limit stimulants like caffeine if advised, as they can trigger dysrhythmias. Medications should never be discontinued without consulting the healthcare provider, even if symptoms improve. Great job completing today's NCLEX practice. How many questions did you answer correctly? Let me know your score in the comments below. I'd love to hear how you did. If you found this video helpful, please like, subscribe, and share it with a friend who's also preparing for the NCLEX. Remember, every question you practice brings you one step closer to becoming a confident and successful nurse. Thank you for watching, and I'll see you in the next NCLEX practice session. Until next time, keep learning, keep practicing, and stay on your path to nursing.